use the analogy that mobile phones are the new toilets to make it fun and memorable, but it actually is really powerful because the toilet has had an incredible impact on stabilizing our society through public health. So ensuring safe water supply, reducing parasitic and infectious disease transmission. It's had a tremendous impact on reducing infant and child and maternal mortality. Having modern sanitation has just changed our world. But now, more people have mobile phones than toilets. So the UN, the United Nations report recently said that more people have mobile phones than access to toilets. And if you look at where people are investing, they're all bringing in mobile phones into their homes because it helps them have job security, it helps them with access, with awareness, with education, everything that helps them to stay safe and secure and have the basis for a good life. So there hasn't been enough studies done yet on the public health impact of mobile phones, but if you look at all the assets, all the aspects of life that the mobile phone touches and can improve, I think data will show us very soon that the mobile phone is now the new greatest invention for helping the world be a healthier place. Good question. Bayer is putting a lot of effort into the digital world because we exist to help people and animals and plants. And now the way the world works is very digital. So to meet the needs of our customers, we have to innovate a little differently and bring in this digital component to all of our work. So we still have brilliant scientists in our laboratories and great physicians in our clinical development and medical, and we still have the core competencies of turning the molecules into things for humans and animals and plants. But now in addition to that, we say, how do we take what we do really well and add in this digital component, add in the analytics or the Pill Plus, or something else that will make it even more meaningful to help more people use it. So it's the way that we keep meeting our customers' needs, and actually it's a new way of bringing science to help improve lives. It's a good question. Why haven't pharma apps been more successful? Well, we're scientists. We turn molecules into products, and that is a very specific expertise. And now developing expertise in areas of apps and digital technology, that's something where it's a new area for everyone. So even the startups here are experimenting with it, but for big companies like pharmaceutical companies, it's much harder. So I think it's a mentality change as well. Often pharmaceutical companies think going digital means taking what they already have and putting it on a PDF or putting it on an app, whereas a real digital experience is much more interactive and connected and more engaging. So we're also trying to figure it out, how to do it best and meet customer demands best. I think where we'll be most successful is by partnering with startups like the ones here to help us bring our core competency and complement it with the new technologies. So maybe when you ask me next year, we'll have some great examples of how pharma has now done blockbuster apps that have helped people to manage their chronic disease and improve their life. That would be wonderful. I think right now we're still waiting to find out. So we know that digital is changing business models. It's making a change in focus possible. So now with predictive analytics and modeling, we're moving towards a world where you're purchasing an outcome rather than purchasing products or a pill. Many companies are trying to experiment in this area. So we're slowly moving in that direction. But the business model hasn't changed yet. So hospitals and doctors and payers, we all still work the same way. We'd love it if the business model changed so that it was better for everyone. But right now it's still in this massive experimentation phase to see how it will change.